Hello and welcome to Health Professional Radio. I'm your host, Neil Howard. Thank you so much for joining us for this segment. In this segment, we're going to be speaking with Dr. Erika Kemp. For kids on the autism spectrum, water can be extremely dangerous. Drowning is the number one cause of accidental death among children with autism. Dr. Kemp is a pediatric occupational therapist at the Ohio State Wexner Medical Center, and she's joining us to talk about an adaptive swim program specifically designed to teach the essential skills of swimming to young swimmers on the autism spectrum. Welcome to Health Professional Radio, Dr. Kemp. Thank you for joining us this morning.
Thank you for having me.
When it comes to kids on the autism spectrum, talk about some of the challenges, especially when participating in activities, like swimming, but not limited to swimming with their peers.
Right. So children on the autism spectrum often have difficulty with communication and with social interactions. And so that often then leads to challenges in activities. If you think about so many kids' activities, they're often in a large group and there's lots of kids running around and maybe one or two adults. And so it's difficult for these children sometimes to figure out what are they supposed to be doing, who are they supposed to be paying attention to, and to really understand sort of the general flow for any sort of active sport or anything that kids do outside.
Water has its inherent challenges anyway, but for kids with autism, why is it particularly dangerous, and why is it the number one cause of accidental death among this group?
So if you think about the properties of water, it feels so different on your body than just being out in air. And for many autistic kids, their sensations, the way they interpret sensations is very different. They have their nervous system responds differently to touch and muscle activation and sounds and that sort of thing. So when they discover what water feels like, and if you think about when you go into water, everything, it's almost like a big, deep hug from the water. And sounds are different if you can get your ears under the water. And so we find that many, not all, but many autistic children are drawn towards that sensory experience. Mm-hmm. But then the problem is that they're not able to typically learn how to swim and how to float their bodies in the same way that other kids are. So they're drawn to this water. They want to be in it, but learning how to swim and how to float, some of those safety skills, is just much harder to accomplish in a typical group swim lesson environment. And I assume that it's hard to communicate the dangers of water to someone on the spectrum. Absolutely. Mm-hmm. Yeah, they just don't have those same safety awarenesses. And many of them are prone to wandering, or what they call elopement. And if they see a body of water nearby, they're just going to go check it out without having any of that awareness that is not a safe activity for them. Tell me a bit about this adaptive swim program. What does it consist of, and how do you determine whether or not a kid is a good candidate for it? Yes, so we do a thorough occupational therapy-based evaluation with each kid. And I think so this is still in a group environment, so we're trying to keep that idea of seeing other kids learn to swim, but it is very individualized. So based on that initial evaluation, we're going to take a look at how does the child move, how do they learn new motor skills, how do they communicate, and then take those differences, how they learn, and use that to our advantage in the water. So each child is paired with a one-on-one swim buddy, and we create individualized goals. And then they rotate through these different stations, and the stations really help break the skill of swimming down into its component parts. Because if you think about swimming, there's so many things going on. You've got to hold your breath, and the water is on you, and you move differently, and everything looks differently. So it's this idea of really individualizing the way we approach teaching to each child. Is it more a matter of learning and communicating skills, or do autistic kids have deficiencies with their muscles that just won't allow them to actually negotiate the water, even if they do learn? And it's an interesting question. I think that we don't pay enough attention to how kids with autism do learn to move, because in general, they all learn to walk, and that's like a big focus with kids. And, from their parents' perspectives, well, do they walk? Well, yeah, they walk, so their motor's fine. But, the reality is I think that many of them have difficulty planning out motor tasks, executing them. We often see many of them have like lower muscle tone. They just at rest are, they just look like they want to curl up sometimes. And so getting them to activate all of that and then put it together with that higher executive function of how do I plan this whole motor movement is very difficult for many autistic people. And so I think that this individualized approach is really using some of these motor learning approaches to help them break the skill down into its component parts so that they can successfully learn to move in water.
Once a child has been assessed and accepted as a good candidate for this program, you're talking about, motor skills, communicating. Once they're in the pool, are there exercises that help them to actually activate these movements and gain some muscle memory in order to be able to learn to swim?
So we do a lot of repetition of the activities, the same type of activity week to week, and make sure that we're getting lots of repetitions of that movement. So when you think about kicking, many children often begin with like a bicycle type of kick in the water, and that's not really efficient. So, for example, we'll embed a lot of activities throughout the whole day where they're using their whole leg to kick, really more with their knee and extension, and using fins and flippers. And so it's this idea of targeting the movement we want them to have and then training them to be able to do that in multiple different games. Everything's very playful that we do. And so sometimes they don't even know what it is that we want them to do. They just the game kind of forces them into that body position to do that. Because what I've found is when I tell them, verbally, keep your legs straight, they don't know what that means. But if I, put flippers on them or extend their bodies on their stomach so they're reaching for something and then encourage them to kick at the same time, their bodies sort of do it unbeknownst to them, sort of thing.
Talk about some of the improvements that you've seen in kids who've gone through the program so far, and then tell us whether or not these techniques and or skills can be applied to other areas of motor skill challenges or learning, not necessarily in the pool.
Yeah, so we've seen such amazing progress with the children. Many of these kids that have come to our program have tried private lessons or adaptive swim lessons elsewhere and have not made any progress, but they have made progress with us. Particularly, we see improvements in swim skills, of course, but we also see a lot of improvement in just cognitive safety awareness of the pool and understanding of who is the lifeguard. What does it mean when they blow the whistle? What is this circle with the person on it? The no diving symbol, what does that mean? We also see a lot of improvements just in transitions between activities, particularly within the loud pool environment. So we see a lot of things transfer, I guess, into their regular lives. And I think one of the great things about this is that the families are present for all of the sessions and they get in with us on the last session so that they're able to really learn, well, how do I talk to my kid in the water? What do I need to say or do with them to help them be safe around the water? And so we do see this transfer to outside the pool.
Give us a website where our listeners can learn more, if you would.
Sure. So there's a lot of information on the National Autism Association.org website where they do have some listings of places people can try to look for adapted lessons in their own areas. And then also Ohio State has some resources on our program as well.
Dr. Kemp, thank you for joining us this morning. Lots of great information, and I'm hoping that you'll return.
Thank you so much.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Dr. Erika Kemp, discussing the prevention of the number one cause of death for autistic children, which is drowning. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes, listen in, download at SoundCloud, and be sure and subscribe to our YouTube channel at youtube.com/healthprofessionalradio.